Welcome, everyone. My name is Laura Tamblin Watts, and I am the CEO of CanAge, Canada's National Seniors Advocacy Organization. And as we are in the last run up to the election, it is my great pleasure to introduce to you the leader of the Green Party, Annamie Paul. And she's been the leader of the Green Party in Canada since 2020. But before that, she was a lawyer, an activist. She worked as an advisor to the International Criminal Court in The Hague, and she's been devoted to human rights and fighting climate change. We're especially proud that she's been elected as the first Black Canadian and the first Jewish woman as a leader of a major federal political party in Canada. And May, thank you and welcome to our show today.
Thank you so much for having me.
We know that the Green Party has prioritized funding for the well-being of seniors. And in particular, you've spoken a lot about long-term care and home care, and this is a personal issue for you, we know as well. So CanAge has proposed a seniors care transfer that has been strongly supported by other members of our organizations as well. But I wonder if you could share a little bit about how your party will address the issues of seniors care.
I mean, I think it's a very innovative thing, the idea of a seniors care transfer. I really think that after everything that we've been through during the pandemic and still are going through, and what we've seen in terms of how it has impacted seniors who really have just absolutely not been taken care of in the way that they should, that it is time for a complete reimagining of how we care for seniors in this country, how we ensure that every senior can live with dignity. And I think that requires a holistic approach because things are interconnected and there isn't any area pretty much that doesn't have some element where seniors would be impacted. So whether it's housing, of course, things like pharmacare, whether it's long-term care, whether it's pension plans, it's time to start filtering everything through the lens of seniors and senior care and life with dignity for seniors. And so, yeah, this is an idea that really intrigues me and I think could be quite transformative. And I mean, you touched upon the personal part. There's the personal part that informs it. And, Laura, this is one of the reasons it's so important to have different people with different kinds of experiences in politics, because there is no question that those experiences, life experiences, professional experiences, they inform your approach to public policy. Certainly in terms of seniors, I'm very close to my mom. She's 85. My father was in long-term care and passed away during the pandemic in avoidable circumstances, like so many thousands of others. I have other people that I care deeply about who are seniors, and so seeing the struggles that they and people in the community have had to endure, particularly over the last year and a half or so, has been very painful to watch. And certainly we can see that we are not treating seniors in a way that reflects the contribution that they have made and the way that we should be able to in a wealthy society. And so this is the time to say never again with any of that. We are going to reform long-term care in the ways that, Laura, you and I have talked about on other occasions. We are going to ensure that we invest properly in community care, in innovations and allowing people to age in place. We're going to have a national dementia strategy. We're going to ensure that seniors are no longer the victims of abuse and violence unnecessarily because we haven't put protections in place. Whatever you're looking at, whatever policy issue you're looking at, you should always be filtering it through a senior's lens and asking yourself, are these things going to leave seniors better protected? Is it going to ensure a life of dignity for seniors going forward? Because we have not been doing the job that we should, and it's time that we start.
You've been passionate on this area, leader. This has been an issue that's been close to your heart, and I think also very close to the hearts of so many of the people who are watching today. One of the areas that you've been talking a lot about is health equity. And I know that you've been, again, raising the red flag about making sure that older and also immunocompromised people get the vaccinations that they need. And we know that about 96% of our CanAge members agree that Canadians should have equal vaccines to vaccines. And right now, so many people across this country can't get vaccinations that they need, and it's too expensive because they're not covered. And we also know that about 84% of CanAge members are saying that the federal government should lean in and prioritize vaccinations under their health mandate for things like preventable diseases of flu, pneumonia, and shingles, in addition to COVID-19. You've also focused a lot on the idea of health equity in terms of pharmacare and how vaccines are part of keeping people healthy and well. I wondered if you could just share a few perspectives on the importance of vaccinations and the importance of health equity.
Yeah, and look, there's some things that are so overdue, where we have become outliers, but in not the ways that I think Canada should be an outlier. We're the only country that has universal healthcare or Medicare that doesn't also have universal pharmacare, and it is just again, it's just a totally unacceptable and just bizarre set of affairs that a doctor can diagnose an illness or disease and prescribe a treatment, and then we have so many people who are not able to afford that treatment. So that is a set of circumstances that just needs to end. We have seen how important vaccinations are, that they save lives. And beyond COVID, we know that having your annual flu shot, for instance, saves lives. The only time, only one of the two times that my mother has ever been in the hospital was because she got pneumonia and through the flu. So they save lives, and it should be something that everyone should have access to. So we are big supporters of universal pharmacare. It's something that should have been brought in the last session. It's something that's been recommended in independent reports submitted to Parliament. And the time has come for that 100%. So when we talk about health equity, we need to ensure that every single person in Canada has access to the same high quality of care. It does require the federal government to sit down again with the provinces and hammer that out on behalf of the people in Canada, seniors included.
Now, CanAge believes that the division of powers is not there to stop people from getting care, but is there to make sure that there is an overlap of care. And that same piece also has to do with our economic well-being. You know, and I know that the pocketbooks of older people are often very strained, even people that we may think have assets, but very low income. And as we are aging longer, and in many cases aging well, that can mean that we need to keep our savings going. We're very concerned, of course, about pension issues, and we know that people have been putting their own deferred wages into the hands of pension plans like Sears, like Nortel, and others. But when a company goes bankrupt in Canada, where older people who've been putting their own money in are in the back of the line. And we also know that there are really restrictive policies like mandatory withdrawals for RIFs at 71. And there are extra costs that people have been bearing as well, caregiving costs and others. I'm wondering if you could just speak a little bit to some of your thoughts around how to support the economic well-being of Canadians as we age.
Yep, it's. I mean, you really summarized it well, and you and I, through our conversations before, you know that our approach to these issues is really to be guided by civil society organizations like CanAge, who are closest to these issues, who hear most directly from the people most impacted. The goal should always be to create public policy that is responsive to those concerns. And we don't have to guess. There are such great organizations like yours out there that have helped to guide the creation of our policy on these issues. And certainly we have been hearing about the same concerns that you expressed. In terms of pensions, you're absolutely right. We have been encouraged for such a long time to rely on the pensions, to encourage to believe that nothing could ever interfere with those private pensions. Seniors are often at the back of the line if anything goes wrong, just in terms of who gets paid first and who gets taken care of first. So we very much support amending legislation for federally regulated pensions to ensure that seniors and individuals get bumped up to the top of the line, that they get prioritized in terms of which debtors get support first. And certainly in terms of the Canada Pension Plan, it's so important for it to remain adapted to the actual needs of people, and so that it is replacing income at the appropriate rate. You have heard, I'm sure, that we are big fans of a guaranteed livable income. This isn't something that is meant to necessarily replace existing benefits, but it's meant to be there to top up where needed, so that people have truly livable incomes at whatever stage of life they may find themselves in. And if you combine that with a properly harmonized Canada Pension Plan, it could really be a game changer. Those are some of the things that we propose in our platform. And I'm sure that working with CanAge and other organizations, there are other innovations to make sure that seniors are better protected. I've heard personally from so many seniors that have described, including my mother, the additional costs that the pandemic has created for them that simply is not reflected in the payments that they're receiving through their pensions or otherwise. And that's an unacceptable state of affairs again, and one that is totally solvable. So, let's get solving.
I'm going to build on that from one of our members today, the Canadian Network for the Prevention of Elder Abuse. And Annamie, they're asking a little bit about some of the neglect and abandonment in long-term care homes. So the CNPEA asks, from the scandal of senior neglect and abandonment in long-term care homes, which you've been passionate about, to ever-increasing reports of elder abuse in the community, older Canadians have been dramatically affected and victimized during this pandemic. What steps does the Green Party plan to take to strengthen prevention and foster a national response to elder abuse?
Yes, and it is so important for us to recognize that. And, Laura, one of the things that has been a bit discouraging and disheartening for me is how quickly I feel that we are forgetting what we have been through during this pandemic. The pandemic is not even over yet, and there has been so little discussion during this snap election about seniors, about the 15,000 plus long-term care residents who died over the last year and a half. Again, many of them unnecessarily, about the thousands others who didn't die directly of COVID, but died from some of the things that you were just describing. I mean, who can imagine malnutrition, treatable infections, dehydration? These are things that should have provoked a national soul searching, should have provoked emergency meetings in order to do everything that we could to staunch the deaths and the neglect, even as it was happening. And it didn't. That is something that I don't want us to lose track of. And so certainly for us, we have prioritized in our proposals for seniors violence and abuse prevention. I mean, we want to see a national strategy for that of course is led by those organizations and those who are closest to the issue. Because it is, again, it's preventable, and we have put off the work and the investments for too long. And we really do need a national strategy, because as you said, wherever you are in the country, you don't want our system to be the barrier to the kind of support and protections that you need. And so in the next session of Parliament, I'm hoping that across party lines, we can come together and introduce strong legislation in this area, propose a strong national strategy along with the provinces, so that we can learn the lessons and pay tribute to all the people who lost so much during the pandemic.
I think that would make such an important leadership role and really lift up the stigma associated with older adult abuse, because we
Yeah.
talk about child abuse and intimate partner violence, and we really need to understand that we're looking at about 1 in 6 people experiencing abuse and neglect. Let's talk national strategies for a second. Dementia is linked to more COVID deaths than any other comorbidity in the country. And the Alzheimer's Society of Ontario asks this: in long-term care and in the community, people living with dementia and their care partners have been pushed really past their breaking point in the last year and a half. If elected, would a Green government commit to fully funding Canada's national dementia strategy? And I'll just add on to that. We have one. The Liberals brought it into force, but really almost nothing has been done with it. And we know that dementia is such a growing concern. Can you speak a little bit about your thoughts on dementia and what we need to do in Canada about that dementia strategy, which is currently unfunded?
Well, that's the thing, the passing a piece of legislation is really only the beginning. It's about what happens next. It's about funding it properly. It's about making it a priority. It's about seeing it through. And that is the issue with our national dementia strategy. You can say we've done it, unless you care about the impact, and then we haven't really done it. And so of course, we have been very, very supportive of a national dementia strategy. We very much want to see it have real content, real substance, so it can make a real difference in people's lives. And of course, some of the things that you touched upon there, I mean, people brought to the breaking point. It's one of the reasons, for instance, we're so keen, along with a number of other parties, finally, in bringing in a guaranteed livable income. Because just yesterday I was doing a town hall, a telephone town hall, and one of the callers described exactly the situation that you did. She's the caregiver for her mom. Her mom is struggling with dementia. They can't afford a personal support worker. She's concerned about losing her job because of the amount of time that she's had to take off, and she doesn't know how she's going to be able to support herself. This is where a guaranteed livable income could really make a difference in terms of allowing people to have enough income to be able to take care of their loved ones in these situations without having to worry about falling into poverty themselves. So again, holistic is the way that we're going with it. We want to see the dementia strategy given some teeth. At the same time, we want to do a much broader radical review of all of our legislation to make sure that it's supporting seniors the way that it should.
Yeah, that holistic lens. We're all aging and we're all supporting each other as we age. But the problem, of course, is that care partners and people who have unknown health needs on a surprise basis, on an acute basis, are really in a tenuous position. And it's interesting because, of course, many critics of a guaranteed income have had to really, I think, rethink it when they've seen the success of some aspects of CERB. So that's very interesting. I'm going to wrap up about the future. And we have been really thinking about the ways that we need to do things differently. There's a lot of myths out there that older people can't use technology, and it's just not true. And we know that in order to age at place, we need to have social engagement. We need to have more health innovation to let people stay in their own homes longer, but still remain connected to people. And, over the last year and a half, one of the things we have seen is a real explosion in thoughtful ideas around how we can stay close to each other even when we're far away. So we know that age tech is one of those pieces. We can certainly use our time better when we're providing hands-on care, instead of filling out forms or perhaps using old cumbersome systems. So we know that we need to streamline as our population is aging. So that sets up a little bit around the idea of investment in the future of aging, in age tech. We know that about 94% of CanAge members agree the federal government should invest more money in home care. And we know that 90% also say that there should be more financial support for home modifications, things like supports around changing your home for ramps and those types of things. We need that. And in recent conversation with our very dear partners, Age Well, 90% of them believed that it was very important for the government to invest in the age tech sector or technology for older adults. So leaving on a bit of a lifting note, how will the Green Party ensure that older adults have equitable access to technologies and to help them age in place so we can make sure that people stay connected and stay healthy and well?
Yes, thanks for the question. And anyone that thinks that that older Canadians can't get tech savvy, they have never met my mom
Or
and seen
mine.
her, you know, seen her use an emoji. My mom is 85 and had never ever used a tablet, or I mean, even a smartphone. She had one of those old kind of burner phones. And now she is FaceTiming with her grandkids. She has created her own Twitter account. So she has, and yes, she's rocking those emojis. So I assure everyone that absolutely older people can learn and adopt technology. That it has been an absolute lifesaver. And I actually say that literally in the context of the pandemic, to have that technology. It is extraordinary, the uptake in adoption of technology that we've seen amongst seniors. And you're absolutely right. This is the time to use that newfound knowledge, those skills that our seniors have acquired, to really apply it to making life more livable, more comfortable, absolutely. And so, we talked about the importance of keeping the things that we've learned about telemedicine, for instance, and telehealth. We've talked about the need to truly work together to understand all the ways that we can use these kind of technologies to allow people to age in place and in their homes, as we know many seniors want to continue to do. We know that Canada spends about a third less than other wealthy countries on those kind of innovative technologies, innovative solutions that allow for a higher quality of life for seniors. So yes, this is absolutely the time for us to do it. And it's an investment that pays off for all the reasons that we've talked about. It is a very hopeful thing. It's one of the good things that can come out of the pandemic. And Laura, maybe as my final thought, I have to say, I want to have us arrive at a point as a country where we value the lives of our seniors as much as we value the lives of our youngest citizens as well. Those lives are equally valuable. We need to invest in both of them. We need to make sure that seniors are getting the kind of innovative policies like universal childcare that we see the same kind of investment for those toward the end of their lives as well. All lives are equally valuable. And so I hope that we see more of that. And I'm hopeful that with organizations like yours, we will get some of that action across party lines in the next session of Parliament. And I will definitely be rooting for that.
And we'll be rooting for that real cross-pollination as well. We know that it's election time. I already got to do that by mail. A quick reminder to everybody that the most important thing is to get out and vote. Go to our website at canage.ca/election21. You can see the full breakdown of each of the parties, including the Green Party's platform, with lots of comments. And I have to say, Ms. Paul, that it is an extremely robust platform. And I think people really need to make sure that they have a look to see that holistic approach. Just at the end, I'm going to invite to the stage here our colleague from Age Well, Dorina, to give us a little bit of a thank you and a close and a reminder, of course, to vote. So Dorina, over to you.
There we go. Thank you, Diana, in the background there for allowing me to speak. So it's been a pleasure listening to both of you discuss issues that impact seniors across Canada. Ms. Paul and Laura Tamblin Watts from CanAge, thank you for coming together. We're 4 days away from the election results. And so I think these issues are, they're not going to go away after Monday, and it's important that we cover them and we listen to what the Green Party has to say. And Ms. Paul, thank you for taking the time today and joining us. And thank you to CanAge, of course, for hosting these sessions, because I think it's important for all older adults to be listening to what we have to say on these topics. And for me, from the AgeWell perspective, which is Canada's Technology and Aging Network, as the Policy and Knowledge Mobilization Manager there, I'm really excited to hear what your party's views and just your knowledge on those pieces, and the fact that older Canadians are tech savvy, and so we need to meet them where they're at when it comes to that in all sorts of ways. So thank you both, and a reminder again to vote if you haven't done so already.
Thank you. And
Thank
bon
you.
après-midi. Annamie, perhaps there's something that you would like to just say to our French Canadian colleagues as a little bit of a sign off and a final mention. Alors, jusqu'à vous, s'il y a quelque chose que vous voulez dire en français.
OK. Oui, juste pour d'abord remercier les organisations et CanAge pour l'invitation aujourd'hui. J'ai oublié de dire que je me trouve ici sur les territoires traditionnels des Mississauga, Anishinaabe et Haudenosaunee. Je dis avec un grand remerciement. Et oui, au final, pour dire que j'espère, avec l'aide de vos organisations, que nous allons créer un meilleur avenir pour nos aînés ici au Canada. Ils le méritent, et on a vu pendant la pandémie qu'il reste encore beaucoup de lacunes, beaucoup de manières où les aînés ne sont pas très bien soignés, et ça coûte des vies. Ils méritent une vie de dignité pour chaque jour jusqu'au dernier jour, et il faut l'assurer. Il faut avoir une approche de 360 degrés pour l'atteindre, et notre parti est là pour ça. Je vous remercie pour votre travail et votre leadership. Et merci encore pour l'invitation aujourd'hui.
Et bon après-midi and good luck on Monday. Bonne chance le lundi, and everyone get out and vote. Thanks very much for joining us today. Thank you, Madam Leader, and we'll see you next time.
Thank you very much.